So we're going to switch over to the Colorado Office of eHealth Innovation. And John Kennedy is our presenter today. So John, I'm going to go ahead and read your bio now to get a little bit more about you. As one of OeHi's senior project managers, John's work is focused on rural connectivity. He joins OeHi with a background as a high-tech project manager with healthcare policy and finances EPMO, and brings that expertise to bear on the HIE infrastructure and rural connectivity. John is passionate about making healthcare available for all Coloradans and bolstering the data infrastructure, making it easier for members in rural communities to receive Medicaid services. John has spent years in various roles in the military, the private sector, and state government serving the public. And we have a fun fact about John. He has a degree in Korean linguistics and spent a portion of his life interrogating and interpreting for the U.S. Army. So always fun. We love to know as much as we can about the people behind our project. So John, thanks for sharing all that with us. I'm going to turn it over to you now, and I'll move your slide. So just let me know when.
Perfect. Thank you so much, Emiko. That was really awesome. I really liked what you had to say and showed. So we'll, as Danielle said, I am with the Office of eHealth Innovation. This is an office that works with the governor's office, Lieutenant Governor's office. Today we're going to be talking about strengthening social connectedness in rural communities. And as OeHi's representative for rural connectivity, I'm going to be able to talk a lot about the efforts the state is working towards. I did kind of give a little background earlier, and Danielle just did read my background. So that is awesome. I really appreciate the way that we've kind of talked through that today. If we go ahead and go to the next slide. So I'm going to kind of start off with some vocabulary. Again, we're going to be talking about rural connectivity and providers, hospitals, etc. So some vocabulary to get you acclimated to critical access hospitals. This is the Center for Medicaid Services designation for hospitals with less than 25 beds, which are greater than 35 miles from the nearest hospital. Rural health clinics, which is the Center for Medicaid Services certification for primary care clinics that operate in rural underserved communities. Rural counties designated as non-metropolitan, and frontier, a subset of rural counties with especially low population density. Note that frontier is not a preferred term. Next slide, please. So why rural health? Why do we have a separation for rural health versus, how else you say it, regular health? To me, what we're looking at as we kind of established those that are less served, that have less access, and it's just a little bit harder to get those connected to our networks here with the with the state. Next slide, please. So there's a higher burden of poverty. 20% of rural children live in poverty compared with 11% of urban children. 12% of rural adults lack basic literacy skills. Lower access to healthcare. 45% of rural Coloradans have public health coverage compared with 35% of urban Coloradans. 54% of rural counties completely lack OBGYN services. And worse health outcomes. 9 of the 10 Colorado counties with the highest opioid death rates are rural. And rural teens are twice as likely to complete suicide as their urban peers. Next slide, please. So we're working to reduce the rural connectivity gap by facilitating HIE connectivity, which is to subsidize fees and provide technical assistance to ensure easy connections. Providing real-time analytics, which is to establish and expand data connections to make holistic patient and business data available in one place. And of course, applying technology to practice. Operationalize those tools to optimize workflows, reduce provider burden, and improve reporting capabilities. Next slide, please. So progress to date, if you'll go ahead and go to the next slide. So prior to where we are now, most of our work and efforts were done under high tech. Some of you may be familiar with that. That was a funding stream that came from the Centers for Medicaid and Medicare Services directly to Colorado that helped us to reach out and connect to various providers and kind of further technology and innovation in Medicare and Medicaid, specifically Medicaid. So up to date, we've done the analytics platform has developed, 75% of safety net facilities have access. Environmental scan has been completed, 61% of safety net facilities participated, and HIE access is improved. 20 new safety net facilities have onboarded. Next slide, please. So after high tech ended, these funding streams, which was just so everyone knows, high tech ended just 2 years ago. And all of the work that was being under high tech was then moved into its own separate area. So rural analytics was taken out of high tech, and now it's its own working, operating program that we're working towards. And as we work towards that, as we get our own funding for that, the state has $11 million to spend for rural connectivity, to get rural analytics, to get data and information out to our rural providers and from our rural providers, which will better help us with all of those statistics that we were talking about before. 72 of 84 total rural safety net facilities are connected to our health information exchange. The HIE connectivity strategy to connect remaining critical access hospitals and rural healthcare clinics has been finalized. Additional rural connectivity funding has been approved for state fiscal year 23, and an implementation plan for a minimum viable product solution for analytics with a fall 2022 release. So coming up right out the gate. An outreach program to reach the remaining rural providers is in the works and will be completed by the end of 2022. That's going to entail us going directly out to these rural communities and counties and reaching out to them and saying, what's the best way to get you connected to our HIE system? The more connectivity we have, the more data we have, and it's the best way for us to help serve our members. When a member's Medicare and Medicaid services are connected, it helps us to better understand how they're being served, what they're being prescribed, what treatments they're receiving, and things like that, so that their primary care physician knows what's happening and they can better serve them. Our focus for continued effort is independent and rural health practices where most rural patients and visitors receive care. Improved condition results in this outreach and this connectivity is a better experience for patients, lower burden for providers, and a cost savings for all.